So today I'll be speaking to us on a condition we call hypoactive sexual desire disorder or sexual desire disorder. Now, in this condition, there is a persistent, little or no interest in sex for at least 6 months. So it happens that the individual does not desire sex for any reason for at least 6 months, even when the indices for arousal are present, the person does not really have interest. Now, this is a very common condition, and it affects mostly women than men. It's commoner in women. Then it's really a very serious condition because it affects one's relationship with a partner. I know one of the goals of a marriage is copulation, sex, and all whatnot, but you find out that your partner for at least 6 months, anytime advances are made, the person doesn't really feel like doing anything in the mood. It kind of like affects the relationship. Now, if these are some of the symptoms that someone that is having this kind of condition will experience: one, the person has little or no interest whatsoever with respect to sex. Secondly, besides that, there is no sexual thoughts or sexual fantasies whatsoever. The person thirdly has disinterest in initiating sex, and it happens that even when the person is being stimulated for sex and anything that is sexually related, the person does not have interest at all. Just that the person is just there, and it's really a serious condition. Okay, so below are some of the things that can lead to this condition. Firstly, we have age. It's been noted that the higher the age, the lower the sexual drive. So it kind of like affects some individuals. Secondly, we have things like pregnancy, births, and the whole maternal period. Well, this scenario, it can go both ways. For some individuals, this period of pregnancy, childbirth tends to increase the sexual drive, but for most women, it tends to reduce it. Then we have things like anxiety. When somebody has an anxiety disorder, sex seems to be the last thing on their mind. We have depression. People that are depressed, at least one of the symptoms of depression is that the person loses interest in what the person used to like and does not really want to engage. Then we'll have low testosterone. Now, testosterone is the body's major sex hormone and is the primary hormone that drives sex in men. Now, for people that have low testosterone, there are many causes there are many things that can actually cause low testosterone. When the testosterone is low, the person tends to have a low libido. Then another cause, medications. There are some medications that tends to affect libido. Some antihypertensive, some antidepressive drugs, they tend to affect libido. So if you're having this kind of condition, maybe your drugs needs to be checked. And we'll have some long-standing diseases like diabetes, they can cause it too.